All right, so in trying to diagnose pregnancy or confirm that a patient is pregnant, you have to actually do history taking. So history taking is the first thing you are doing before physical examination. All right. So for history taking, we just take a time and look at what are the possible questions you need to kind of like ask the patient and all of that. So for history taking to diagnose pregnancy, or so to say confirm pregnancy, first of all, the importance of it is, as you are taking a thorough history taking, is the first step if you want to actually confirm pregnancy. So it helps to guide clinical decisions, identify if complications will come up, and this is kind of like the first thing that is introducing you to the patient. So it will determine whether the patient will come back to you or whether the patient will keep telling you their secret or not. You understand? So it's very, very crucial, and you have to kind of like be very calm for this aspect. So key components of this history taking is presenting complaint. So most of the times, if a woman comes with missed period, or she has not been having period for some couple of months, yes, and you ask further questions like, has she been vomiting? Is her breast all of a sudden so soft? Is she feeling weak? Is she urinating more? Do you understand? The menstrual history. So date of last menstrual period, you pick it up too. Then check out how regular the menstruation is coming out, how long it is coming out, flow of cycles, right? Then if she has had any history of painful menstruations or other menstruation abnormalities, right? So obstetric history, you ask her how many times has she been pregnant. Of course, with this one now, you are also trying to ask when she was pregnant, did she deliver through the vagina or it was CS? Do you understand? All those things will help you to make decisions. So term pregnancy, you ask her if she has ever had any babies that she successfully gave birth, or she had any babies that she lost. If she has ever had any abortions, then how many of her children are still living? Okay. So also ask for any complications in previous pregnancies, mode of deliveries, okay, birth weight and outcomes. So sexual and contraception history, you ask her for recent sexual activity, alright? Ask her if she has used contraception during the sexual activity, okay? Types of contraception that was used. The medical and surgical history, this one I'm just trying to ask her if she had previous surgeries, if she had any previous illnesses that that could basically bring up complications in the pregnancy. The family and genetic history, that's hereditary conditions. Do the family actually have some one or two disease conditions, hereditary ones? So you are looking at the possibility of, let it not be that this woman is pushing some disease condition to the baby. Do you understand? Then also history of congenital anomalies or genetic disorders. Then psychosocial history. So support system. Does she have a partner? Does she have a family that can be able to support this pregnancy? Emotional response to possible pregnancy. Has she been using substances? Domestic violence or abuse concerns. Then you review all other systems. Look at the gastrointestinal. Is she having some complications there? Genital urinary. Are there some complications there? The breast. Then general. Okay. So that's just it. These are the subtle things that you shouldn't miss out. There's so many additions depending on how your medical school is training you guys. But for these ones, you shouldn't actually miss them out in trying to diagnose a pregnancy.